Hello, my good people. How are you doing today? Dominic here, and welcome to my Healthy Talk show today as we keep on educating each other. So, today we want to talk about something very important, and it's something that is affecting many people in this country and everywhere else. A few days ago, one of the opinion poll company released a report about the status of the country in terms of cost of living, in terms of the economy. And one of the report it gave out was that some Kenyans, all people are battling with mental illness, which is basically associated with be it high cost of living, lack of money, and other problems that are facing. So it's one of the things that I believe it's barely talked about. Mental health. Many times it's one of the things that is very much neglected. People are battling with a lot of mental illness out here, be it from stress, depression, and very many other things. You have seen most parents are not able to take their children to school because of lack of school fees, lack of funds, and this as we brought about the issue of mental health problems. So today we want to talk about one of the main mental problems that has affected most people. You've had people who have committed suicide. You've had people who have thrown themselves from buildings. Others have thrown themselves into rivers and drowned to death. Others have even killed their family members. Others have sunk to different mental problems. Others have even, left their kids on the roadsides because they are not able even to take care of them. So today, I want to talk about depression. I know this is something most of you have heard about. Maybe some of you have even gone through it. But we want to look at what's really depression, what brings depression, how can you identify if you are depressed, right? So welcome as we talk about this problem. So basically, when we talk about depression, we want to define what depression is. Depression is basically a moody disorder, right? That causes persistent feeling of sadness and the loss of interest. I repeat again, it's a moody disorder that causes a persistent feeling of sadness and loss of interest. Sometimes you can call this one as a depressive disorder or clinical depression. So it affects how you feel, how you think, and how you behave. This can lead into a variety of emotional and physical problems. So basically, that is how we define depression. So how will you be able to know that you are depressed? That is a very important thing. You might be depressed, but you don't know basically if you are depressed. So we want to look at the signs and symptoms of depression. This is very important. There are very many of them. I'm going to list a couple of them so that you are able to know if the symptoms you have, are they due to depression or something else. So number one symptom is what we call feelings of sadness, tearfulness, emptiness, and hopelessness. You just feel that you don't have anything in this world. You feel you're hopeless. You feel you're empty. That is number one. Feelings of sadness, tearfulness. You find somebody is even crying. That's number one. Number two, angry outbursts, irritability, or frustrations even over small matters. You find yourself getting angry over even small things. For instance, you're in your house, your child picks up a remote and changes the TV channel. You get so angry, you may even beat up this child. Someone passes by you and you just feel like he has obstructed you. You get irritable so easily, getting angry outbursts. That is one of the common and the main symptom that you might be depressed. That's number 2. Number 3, sleep disturbances, including insomnia or sleeping too much. Sleep disorders, this is what we mean. Insomnia, this is where you barely get sleep. You are in your bed, but you're just awake. That is one of the symptoms. Others get what you call too much sleeping. You are not productive. You're at work, you feel sleepy, you can't concentrate at your work because of sleepiness. That is one of the signs. That was number 4. Number 5, tiredness and lack of energy. So even small tasks take extra efforts. You feel so much tired, you feel like you don't want to do anything. That is a sign that you might be depressed. Number 6, reduced appetite and weight loss or increased cravings for food and weight gain. So it's either way. You end up eating too much. There are people when they're in depression, actually they eat and even overeat. Others, they lack now appetite completely. So those are some of the signs. Number 7, I think, yes, anxiety, agitation, or restlessness. Being restlessness is where you're not settled. You get anxious over something small. Someone talks something, you're restless all the time. You're not settled in whatever you do. That is one of the signs. Number 8 is what we call slowed thinking, speaking, or body movements. You find it's like your mind is clogged. You're not able to comprehend things very fast. Somebody may tell you something and you take so long to process the whole thing because your mind is clogged. You're not thinking properly. When you find that even something you used to do in a very short period of time, you are taking much time to do it, then you might be depressed. Number 9 is what called feelings of worthlessness or guilt, fixating or past failure or self-blame. Feeling of worthlessness. This is where some people even end up having what you call suicidal intents. You feel like I don't deserve to be alive. You feel like you have failed completely in your life and even the people around you. So these are people, even sometimes they feel like now they should take away their life. That is number 9. Number 10, trouble thinking, concentrating, making decisions, and remembering things. Sometimes you find yourself, you're having memory lapses. You put your phone somewhere and you're looking for it, you can't find it. Or actually you're looking for your phone using the torchlight of your phone, right? Because your mind is so clogged that you're even not able to remember some things. So thinking becomes difficult because already your mind is depressed. That's number 10. Number 11, frequent or recurrent thoughts of death, suicidal thoughts, suicidal attempts, or suicide, or just suicide. So we have talked about that again. So you're always having those kind of thoughts, feeling of worthlessness. You just feel like you need to take away your life because everything else is becoming too much for you. So when you find yourself thinking about, you should have left this world and die, that is a sign that you are depressed. And lastly, that is number 12, unexplained physical problems such as back pains or headaches. You might be having a headache, you might be having body pains, which are not associated with anything else. You have not worked maybe physically, you have not done anything strenuous, but you're having body aches, you're having a headache that is not subsiding. That is a sign that you are depressed, right? So basically, those are some of the main 12 signs and symptoms that you could be depressed. There are very many of them we could talk, but those are the main ones, right? So having looked at the signs and symptoms, basically, I know people will be interested. How do you get help, right? Of course, some of the causes maybe, people may want to know what could be the causes of depression. I will just mention some of them. Could be some biological differences, right? Brain chemistries, yeah, some hormones predispose someone to having those kind of things, inherited traits, yes. But what we call risk factors for the depression is what we call certain personalities. There are some people who have a personality that are prone into depression. Traumatic stress events. People who have gone through some traumatizing events in the previous, they end up getting depressed, right? Another thing is difficult relationships and financial problems, right? People are having trouble in their marriages. Maybe there's a cheating spouse, right? Difficulties in financial, right now, this January, many people are having financial problems. It's one of the risk factors, right? Some other things, when you have blood relationship or relatives who have had issues to do with the depression, you might be at risk factor of having the same, right? Then history of mental illness in the family is another risk factor. Abuse of drugs, alcohol and other recreational drugs is another risk factor, right? Some medications can also cause such kind of problems. So basically, those are some of the risk factors of depression. So when you get so much depressed, you may end up having some complications. So what are those complications that you may have when you are depressed? One is excessive weight loss or weight gain. You may have pain or physical illness, alcohol or drug misuse, right? Anxiety, panic disorders, or social phobias. You may end up having suicidal feelings. You may end up having self-mutilation, such as cutting yourself. Premature death is one of the things, right? So how can you be able to prevent depression? Or management or treatment, right? So there is no much you can do with preventing depression. However, there are some things that you can help so that you are able to manage this. First thing, take steps to control stress, to increase your resilience and boost your self-esteem. Number 2, reach out to family and friends, especially in times of crisis, to help you weather rough spells, right? Another thing, get treatment at the earliest sign of a problem to help prevent the depression from worsening. So always when you feel you might be having depression, seek medical help. And then consider getting long-term maintenance treatment to help prevent a relapse of symptoms. So if you have ever had depression before, make sure you see your doctor, get medications so that you are able to prevent relapse. So basically, there's a lot we could talk about depression, but that is literal we could say as per now. So I believe you're able now to know what depression is, how it's brought about, the risk factors, the signs and symptoms, and how you can go about it. Always, I want to wish you well, and thanks for your support. Thanks for your subscription. Thanks for following my page, and thanks for always supporting me. As I always say, health is wealth. Keep yourself safe and know your health. Thank you, and may God bless you.